Hello student, in this video we will discuss about thyroid inhibitors or antithyroid drugs. Antithyroid drugs reduce the level of thyroid hormone by reducing thyroid hormone synthesis or release or both synthesis and release, and these drugs are used in the management of hypothyroidism states. So thyroid inhibitors are classified mainly into the drug which inhibit the hormone synthesis, second which inhibit the iodide trapping, third which inhibit the hormone release, and fourth is who destroys the thyroid tissue, and fifth are they inhibit the peripheral conversion of T4 into T3. So first we will discuss about the first group, that which inhibit the hormone synthesis. These drugs are also called as thioamides. The drugs under this group is propyl thiouracil, methimazole and carbimazole. Mechanism of action of these drugs are they inhibit the peroxidase enzyme so that there will be no conversion of the iodide ion into the iodine ion. Next, they inhibit the iodination of tyrosine residue in the thyroglobulin, and they inhibit the coupling of iodotyrosines. In short form, we can say that they inhibit the second stage which we discussed in the previous lecture, that is oxidation, iodination, and third stage, that is coupling. These thioamides will inhibit both second and third step of thyroid hormone synthesis. If we talk about pharmacokinetic of these drugs are well absorbed orally, they are widely distributed and get accumulated in that thyroid tissue, and they are excreted in urine. These thioamides also crosses the placental barrier, so there is a chances of causing fetal hypothyroidism. What are the adverse effects of thioamides? Are they causes skin rash, joint pain, fever, hepatitis, nephritis, and in rare cases, but it is a fatal condition, they causes agranulocytosis. So when the symptoms like sore throat and high fever occur after the starting of these drugs, then these drugs are stopped after coming the symptoms of like sore throat and fever, means they are causing agranulocytosis. So difference between propyl thiouracil, methimazole and carbimazole is that propyl thiouracil is less potent, whereas carbimazole is more potent. Carbimazole has longer duration of action, it is less protein bound, and it is converted to methimazole, which is an active form. The passage across the placenta is low of carbimazole, and its level in breast milk are also low. So the carbimazole is more preferred than propyl thiouracil, but propyl thiouracil is preferred to carbimazole and methimazole for treatment of hypothyroidism during first trimester of pregnancy. Next, where we can use these hormone synthesis inhibitors, they are used in the treatment of as a definitive therapy in treatment of Graves' disease. What is Graves' disease? Graves' disease is a hyperthyroidism state in which there is a toxic nodular goiter is formed, and in Graves' diseases this is used only when there is surgery is not indicated or not feasible, and radioactive iodine is contraindicated. Carbimazole and methimazole is preferred for long-term treatment as it is long-acting and it is not hepatotoxic as compared to propyl thiouracil. They are also used pre-operatively to render patient euthyroid before surgical thyroidectomy. If we have to perform the thyroidectomy, then we have to make the patient euthyroid, means the thyroid level should be in the normal range. So these drugs are used pre-operatively. Along with radioactive ion, they are also used to control the hypothyroidism in patient who has to treat with radioactive iodine, because radioactive iodine has a slow onset of action. Propyl thiouracil is also used along with iodide and propranolol for the treatment of thyrotoxic crisis. Next group is that inhibit the iodide trapping. These are ionic inhibitors, and the drugs under it are thiocyanates, perchlorates and nitrates. They have highly toxic and have unpredictable effects, so these are not used clinically nowadays. Next group is which inhibit the hormone release. There are drug under it are iodides of sodium and potassium, and organic iodide. Mechanism of action is they inhibit the hormone release, or we can say in terms like it cause thyroid constipation. Increased level of iodide inhibit the iodination of tyrosine residues and hormone synthesis. It is also known as Wolff-Chaikoff effect. The preparation available of iodide and iodine is Lugol's iodine, like iodate sodium and epoinic acid, potassium iodide, and tincture of iodine. So where we can use these iodine and iodides. These are used pre-operative preparation for thyroidectomy, means we have to make the patient euthyroid. So they will cause, they inhibit the hormone release. So there will be euthyroid state of that patient. They are also used in the treatment of thyroid storm when there is excess release of thyroid hormone, and they inhibit this release of this hormone and causes the uh, less concentration of thyroid in the body. Next, they are also used for the prophylaxis of endemic goiter. They are used as an antiseptic in the form of tincture iodide, and potassium iodide is used as expectorant. They are mucolytic agent. What are the adverse effects caused by these are like allergic reaction, angioedema, type 3 hypersensitivity reaction, and sometimes they causes lymphadenopathy. And if there is chronic overdose of these drugs, they cause iodism. Iodism, the characteristic feature of iodism are like metallic taste, excessive salivation, lacrimation, burning sensation in oral cavity and throat, and running nose. They can also cause fetal goiter if given in pregnant women. Next group is the drug which destroyed the thyroid tissue, that is radioactive iodine 131. They cause the destruction of the follicular cell. If the follicular cell is destructed, so there will be no synthesis and release of thyroid hormone. These are used for treatment of hypothyroidism due to Graves' disease, in cases of toxic nodular goiter, and a treatment of thyroid carcinoma. These thyroid tissue inhibitors are contraindicated in pregnancy, nursing mother, children, and young patient because they are radioactive. They release the radiations. What are the advantages of radioactive iodine is that treatment is simple, it does not require hospitalization, and can be done in outpatient department. It is a low cost, there is no risk of surgery and scar, and they permanently cures the hyperthyroidism. Next group is which inhibit the peripheral conversion of T4 to T3. As we know that T4 is converted into T3 in peripheral tissue to increase the amount of active T3 hormone. So the drugs which causes the inhibition of this conversion are like beta blockers like propranolol, atenolol, and metoprolol. They are used for to inhibit the peripheral conversion of T4 to T3. These are used to control the symptom of thyrotoxicosis initially till antithyroid drugs act in thyrotoxic crisis and in as pre-operatively before the thyroid surgery. So this was all about the thyroid inhibitors. If you like the video, please like, share, and subscribe. Thank you.